Alright, let's talk about Medicaid. You've probably heard the name. Maybe you even know someone who uses it. Or perhaps, and this is a fun thought, you might need it yourself one day. Surprise! Medicaid is a government program in the United States. It's designed to help people with low incomes get health insurance. Think of it as a safety net, a rather large one, meant to catch folks when they fall on hard times with their health. It covers millions of Americans. Children, pregnant women, seniors in nursing homes, and people with disabilities. It's a pretty big deal. A cornerstone of healthcare for many. Without it, a lot of people would be staring at huge medical bills or even worse, no medical care at all. So, yes, important stuff. Now who exactly gets this help? Well, it's not just a free-for-all, despite what some angry people on the internet might tell you. Medicaid is primarily for people who really truly need it. We're talking about families struggling to make ends meet. We're talking about kids whose parents can't afford private insurance. It also helps elderly individuals who need long-term care. The kind of care that can bankrupt a family faster than you can say, pre-existing condition. And crucially, it supports people with significant disabilities, ensuring they get the ongoing medical attention they require to live their lives. It's a diverse group, all united by the fact that healthcare costs would otherwise crush them. It's a system that, in theory, says your health shouldn't depend entirely on your wealth. The program is jointly funded by the federal government and state governments. This means the rules can be a bit different depending on where you live. Some states are more generous with their Medicaid programs than others. It's like a healthcare postcode lottery, which is exactly as fun as it sounds. One state might cover dental for adults, another might not. One might have a slightly higher income limit, another might be stricter. This complexity is, of course, a beloved feature of American bureaucracy. It keeps things interesting, if by interesting you mean confusing and potentially life-altering. But the core idea remains to provide essential health services to vulnerable populations across the country. So, Medicaid is this massive, vital program. It's there for a lot of people when they are at their most vulnerable. It helps them see doctors, get medicine, and manage chronic conditions. It's supposed to be a lifeline. But like any big government program, especially one involving money and healthcare, it's also a political football. And right now that football is being kicked around rather aggressively, particularly by some new players on the field. This brings us to the recent changes being championed by some very familiar and some perhaps surprisingly placed faces in Washington. Hold on to your hats, because it's about to get a bit bumpy for millions of people. Speaking of new players, let's talk about Dr. Mehmet Oz. Yes, Dr. Oz. Former TV doctor, purveyor of various health tips, some more scientifically sound than others, and now, in a plot twist worthy of a daytime soap, he's the administrator of the Centers for Medicare and Medicaid Services, or CMS. He was confirmed on April 3, 2025. And he's come in with some, shall we say, ideas, particularly about Medicaid. He's backing President Trump's proposed bill, which is looking to shake things up quite a bit. Dr. Oz believes that, when Medicaid was created way back in the 1960s, lawmakers didn't imagine able-bodied working people being on the program, a historical interpretation that's certainly a take. Now, Dr. Oz has been quite vocal about his philosophy. He famously said on Fox Business just recently on June 5, 2025, that individuals facing new Medicaid work requirements should, and I quote, prove that they matter. Yes, you heard that right, prove that they matter. He elaborated, go out there, do entry-level jobs, get into the workforce, prove that you matter, get agency into your own life. It's a powerful message if your idea of empowerment involves the potential threat of losing your health insurance. He also stated, we're asking that able-bodied individuals who are able to go back to work at least try to get a job or at least volunteer or take care of loved one who needs help or go back to school. Do something that shows you have agency over your future. So, what are these new rules exactly? The proposal, part of a larger House Republican tax bill, mandates that states impose work requirements for childless adults aged 19 to 64 to be eligible for Medicaid. There are some exceptions, but the main thrust is clear. Starting in December 2026, if this bill becomes law, these adults would need to work or engage in other qualifying activities for at least 80 hours a month. That's about 20 hours a week. What counts as qualifying activities? Well, it could be working a paid job, volunteering, providing care for a loved one, or attending school. If you don't meet these requirements, Dr. Oz suggests you should go on the exchange or get a job and get onto regular commercial insurance. Simple. The argument from Dr. Oz and other supporters is that these changes are not about cutting Medicaid but about saving Medicaid. He has claimed, "We're not cutting Medicaid," and that the goal is to ensure its solvency and keep it viable for the most vulnerable. He believes these requirements will encourage people to find work and become more self-sufficient. The idea is that a job brings dignity, and Medicaid shouldn't be a disincentive to join the workforce. It's a vision of personal responsibility, where the path to health coverage for some now has an employment checkpoint. Whether this path is accessible to everyone it targets is, of course, where things get a little more complicated. Why all this fuss? Well, supporters of these new Medicaid work requirements, including the Trump administration, have a few key arguments. The big one, as always, is money. The proposed changes are projected to reduce federal Medicaid spending by a whopping $793 billion. That's according to an analysis by KFF, a healthcare policy nonprofit. This isn't chump change. The government argues these savings are crucial. They are part of a larger plan that includes trillions of dollars in tax cuts, and these benefit program adjustments are how they plan to offset some of that cost. It's about fiscal responsibility, they say, and making the social safety net more common sense, according to Office of Management and Budget Director Russell Vought. Beyond the dollar signs, there's the philosophical argument we heard from Dr. Oz. Proponents believe these rules will encourage able-bodied adults to enter the workforce. The idea is that work provides not just income, but also dignity and purpose. They argue that Medicaid, in its current form for this group, might discourage work by providing benefits without requiring active community participation or employment. By tying health coverage to work or similar activities, the government hopes to foster agency and self-reliance. They believe it will help people transition off government assistance and onto commercial insurance through an employer, which they see as a more sustainable long-term solution for individuals and the economy. However, critics are sounding the alarm, and loudly. Their primary concern is the potential for massive losses in health coverage. The Nonpartisan Congressional Budget Office, or CBO, has estimated that nearly 11 million people could lose their health insurance if the full House Republican tax bill, including these Medicaid cuts and changes to the Affordable Care Act, passes the Senate. More specifically, a CBO analysis in May 2025 projected that 7.6 million people could become uninsured just from the Medicaid provisions, including these new work requirements. That's a staggering number of people potentially left without access to doctors, medicine, or essential care. Critics argue this isn't saving Medicaid, it's gutting it. The people most likely to be affected are often those already struggling. Many individuals on Medicaid who can work are already working, often in low-wage jobs with unpredictable hours and no employer-sponsored health benefits. Others face significant barriers to employment, such as chronic illnesses. Even if not officially disabled, caregiving responsibilities for children or sick relatives that exceed the loved one volunteer definition, lack of transportation, or limited job opportunities in their area. Critics argue that these work requirements will simply create a bureaucratic nightmare, leading to people losing coverage not because they aren't willing to work, but because they can't navigate the system or meet the rigid hourly quotas consistently. It's a high price to pay for agency. This whole situation has, predictably, ignited a fierce political firestorm in Washington. On one side, you have President Trump and many of his allies in Congress, alongside Dr. Oz, pushing these reforms as essential. They are framing it as a way to modernize Medicaid, ensure its long-term financial health, and promote work. Office of Management and Budget Director Russell Vought even dismissed concerns about coverage losses as ridiculous, boldly asserting that no one will lose coverage as a result of the bill. A statement that seems, shall we say, optimistic, given the CBO's projections. Many supporters in Congress are echoing this sentiment, downplaying any potential negative impact on access to care. On the other side, Democrats are, to put it mildly, not thrilled. They are strongly opposing these proposed cuts and work requirements. They argue that this is a cruel and unnecessary attack on the nation's most vulnerable citizens, designed primarily to fund tax cuts for the wealthy. They are already running ads targeting House Republicans who voted for the bill, highlighting the potential for millions to lose their health insurance. For them, this isn't about agency or saving Medicaid. It's about dismantling a crucial part of the social safety net. They point to the human cost, the families who will suffer, and the potential public health consequences if millions become uninsured. Interestingly, the opposition isn't just coming from Democrats. Several Senate Republicans have also expressed serious concerns. Senators like Lisa Murkowski of Alaska, Susan Collins of Maine, and even Josh Hawley of Missouri have raised red flags about the Medicaid cuts. They are worried about the impact on the working poor in their states and the potential political backlash. Senator Hawley went as far as to write an op-ed in May 2025 calling the cuts morally wrong and politically suicidal. This internal Republican unease could make it much harder for the bill to pass the Senate in its current form, suggesting that changes might be necessary to get it through. It's a high-stakes game with real human consequences, so there you have it. One side says these changes are about responsibility, efficiency, and getting people into the workforce, ultimately strengthening Medicaid for those who truly need it. The other side says it's a heartless attempt to strip healthcare from millions to pay for tax breaks, disproportionately harming those who are already struggling. Supporters believe people should prove they matter through work. Critics believe people matter, period, and access to healthcare is a right, not a reward for employment. As this debate rages on, the central question remains: what is fair, what is effective, and what kind of society do we want to be when it comes to caring for our citizens? It's something worth thinking about, especially if you or someone you know might one day need that safety net.